struggling with anemia? If you're feeling tired, weak, and just plain run down, you're not alone. Anemia can make even the simplest tasks feel exhausting. But what happens when your doctor says that you need an iron infusion? You start wondering about the costs, and if Medicare covers it. Here's the breakdown of what you need to know about Medicare and iron infusions, explained in simple terms. Section 1. Understanding Medicare and iron infusions. Let's start with some basics. Iron infusions are usually reserved for people who need a big boost of iron fast, especially if they can't absorb it properly through diet or supplements. Medicare can help, but they only cover iron infusions in specific situations. So, let's explore exactly when Medicare can step in, and when you may have to pay some costs out of pocket. Medicare Part B covers iron infusions as an outpatient procedure, but only if it's deemed medically necessary. You'll generally be responsible for about 20% of the approved cost. Medicare Part A. This part can cover iron infusions if they're needed during an inpatient hospital stay, like after surgery. But remember, Medicare Part A has a deductible you'll need to meet first. Section 2. When Medicare covers iron infusions. Iron infusions are an option when lifestyle and diet changes just aren't enough to fix anemia. Here's when you might qualify for Medicare coverage. 1. Severe iron deficiency anemia. If other treatments haven't worked, or you can't tolerate oral iron supplements, Medicare Part B can kick in. 2. Inpatient hospital stay. If you're hospitalized and require iron infusions, Medicare Part A covers these under inpatient care. Whether Medicare covers your infusion depends on your condition, your doctor's recommendation, and whether the services are from a Medicare-approved provider. Most iron infusions happen in outpatient settings, meaning Part B applies. Section 3. Diagnostic lab tests and Medicare Part B. Sometimes, your doctor will need to run lab tests, like a complete blood count, CBC, to understand your anemia better. Medicare Part B generally covers these diagnostic tests when they're considered medically necessary. Here's what that means. Medicare-approved lab tests. Part B covers most lab tests done in a Medicare-approved lab with no out-of-pocket costs. However, if your doctor orders extra tests beyond Medicare's allowance, you may face extra charges. Outpatient hospital setting. If the test happens in an outpatient hospital setting, there could be a co-payment. Medicare Part B's coverage is there to help, but always double-check to avoid surprises. Section 4. Prescription drugs and Medicare Part D. If your doctor prescribes iron supplements or vitamins, Medicare Part D can help cover those prescription costs. But remember, not everything is covered. Medicare Part D's prescription drug coverage varies by plan. If your infusion is covered under Part B, you'll still be responsible for a percentage of the cost, typically 20%. However, this cost sharing can change based on your plan. Section 5. What you'll pay for an iron infusion with Medicare. Costs for iron infusions can add up, even with Medicare. Here's what you might expect. Part B deductible. In 2024, it's about $240 per year. You'll need to meet this before Medicare starts paying its share. Co-insurance and co-payments. After meeting your deductible, you're generally responsible for 20% of the Medicare-approved cost. Medicare Part A deductible. If you're an inpatient, the 2024 deductible is $1,632 per benefit period. These amounts cover more than just the infusion, they include any related services from doctors or healthcare professionals. Section 6. Using Medigap or Medicare Advantage for extra coverage. For help with those out-of-pocket expenses, you might consider a Medigap or Medicare Advantage plan. Here's how they work. Medigap plans. Medigap fills in the gaps left by original Medicare, covering costs like copays, co-insurance, and deductibles. Keep in mind, though, that not all Medigap plans cover every cost. Medicare Advantage plans. Medicare Advantage, also known as Part C, offers the same basic coverage as original Medicare and can sometimes include additional benefits. Make sure to check if your Medicare Advantage plan covers lab services or iron infusions. Each plan is unique and may come with different out-of-pocket costs. Section 7. Medicaid as an extra help option. If you're worried about paying for iron infusions, Medicaid might be able to help. Medicaid is a program for people with limited income and resources. It can help pay for healthcare costs that Medicare doesn't cover, including personal care services or nursing home care. You can contact your state's Medicaid program to see if you qualify. Section 8. Checking what Medicare covers for iron infusions and tests. So, how can you be sure that Medicare covers your tests and treatments? Medicare's online tool can help you check if a specific test or service is covered. This can be a great way to avoid surprises and make sure you're prepared for any extra costs. Checking in-network labs. If you have a Medicare Advantage plan, make sure to use in-network labs and facilities to keep your costs as low as possible. Stay informed. If you're unsure, it's a good idea to call your Medicare provider or your doctor's office to confirm coverage before receiving any services. Section 9. Practical tips for managing your iron infusion costs. Keeping your costs down with Medicare is about planning and knowing your options. Here are a few practical tips. 1. Confirm medical necessity. Make sure your doctor's office and the lab are Medicare approved. 2. Know your plan. Check your Medicare Advantage or Medigap policy to understand what's covered and what's not. 3. Use in-network services. If you have a Medicare Advantage plan, choose in-network providers for your tests and infusions to keep out-of-pocket costs lower. 4. Ask for help. Medicaid may be able to help with costs if you qualify. Don't hesitate to explore this option if you're eligible. Section 10. Conclusion. Iron infusions can be a lifeline for people dealing with severe anemia, but navigating Medicare coverage can feel overwhelming. Knowing what's covered by Medicare Parts A, B, and D, as well as any costs you'll be responsible for, is key to making the best decision for your health and finances. And if you're eligible, Medigap, Medicaid, and Medicare Advantage can all help reduce out-of-pocket expenses. Remember, you're not alone. With the right information, you can take control of your health, manage your costs, and feel confident in your coverage. If you're considering an iron infusion, talk to your doctor and make sure you understand how Medicare applies to your treatment plan. Whether you're looking for a simple overview or you're planning your next healthcare step, I hope this video has helped clear things up. Thanks for watching, and don't forget to like, subscribe, and share this video with anyone who might need this information.
You